Hello, and thank you for joining us today for SBIRT and the Criminal Justice System webinar. Today's webinar is presented by the BIG Initiative, the National SBIRT ATTC, NORC at the University of Chicago, and NADAC. I'm Tracy McPherson. I'll be your webinar facilitator today, and I am at the Substance Abuse, Mental Health, and Criminal Justice Studies Department at NORC at the University of Chicago. If there's any way that I can help facilitate, helping you to get resources and other additional materials and things to help you support implementation of SBIRT in your own setting, please don't hesitate to contact me by email. I'll be glad to assist. The webinar today is produced in partnership by the BIG Initiative, NORC at the University of Chicago, the National Screening, Brief Intervention, and Referral to Treatment, or SBIRT, National SBIRT ATTC, and NADAC. I hope you will visit our websites. We have links embedded throughout the presentation at the beginning and the end, and I hope you will check out our websites and learn more about some of the support materials available to you, including some the webinar today, which we will be offering to you in a recorded format, as well as other webinars that we have to offer. This is the webinar series we have planned for 2014, and on our website address, hospitalsbirt.webs.com/webinars.htm. We have all these webinars, including the one today. We had some really exciting webinars in January and February looking at ACA and addiction treatment. And we had an overview of SBIRT for nurses. So I hope if you have colleagues or you're interested in those two topics, you will take advantage of the free education we have housed on our website. Coming up in the next few months, we're going to have some great presentations on SBIRT and opioid risk, as well as looking at SBIRT and the treatment of tobacco dependence, current best practices around screening, brief intervention for tobacco. And we're going to have a webinar coming in the summer months where we're going to look at the application of SBIRT for other behavioral health conditions, including depression, and how SBIRT is applied in trauma and in other kinds of concerns that practitioners are seeing every day. And of course, further along in the summer, we're going to have a nice webinar about how to integrate screening and brief intervention in social work from an integrated behavioral health perspective, and more on why do integrative care. So we have a wonderful lineup. We have a brochure, basically a flyer that you can download. A picture of that is on the left here, and you can print that out, you can email it around, you can put it up on a bulletin board. We hope that you will take advantage of the free education and the free continuing education credits that we have to offer you. And all of them are recorded and posted on our website for further for your convenience. To access the materials for today, we have all of them posted, including a copy of the PowerPoint slides, which are available to you right now at that web address that you see here on the screen. Also over in your chat box, we have a link. It says download the PowerPoint slides here. Those are available for you right now. So go ahead and take a moment to do that if that's more convenient for you to do. We are going to provide the recording again on the website. That just takes a little bit of time, and usually we get that posted within 24 to 48 hours. We have a lot of other resources, not only resources that might be mentioned today in the webinar, but there are many, many free resources, articles, support materials, implementation support materials. There are training resources. There's so much available to you at no cost on our hospitalsbirt.webs.com website. So please take advantage of that. And we're offering free CEs. We want to make it worthwhile for you to attend. We think the education is incredible and probably worth it even without the continuing education credits. But we appreciate your time and your interest and would like to provide continuing education wherever we can. So we've done that for our webinar series. Different webinars have different CE offerings. This one is going to have one free CE, and you will need to complete the free online CE quiz, which will be made available after the webinar today. You're going to be receiving a follow-up email as well that will give you some links to be able to go to the materials on our website. And the CEs today are approved by NADAC, NASW, and NBCC, accredited by the American Probation and Parole Association, and it's accepted by OASAS, otherwise known as OASIS. We'll have an opportunity today at the end of the presentation to ask questions. You have a questions pane on the right side of your control panel, and you can type in your questions there. And we will field a number of questions at the end. We'll try to get to as many as we possibly can. If there's a burning question that doesn't get answered, you're welcome to email us, and we could connect you to our presenter to see if we could get your questions answered. And behind the scenes is our wonderful Misty Story, who is our technical facilitator, and she is the Director of Training and Professional Development at NADAC, and she can field a lot of the technical questions that you may be asking, and so she'll be doing that behind the scenes and in the questions pane as well. She's very good at helping people navigate any challenges. We don't typically have many, but she's available, and she will be also the person to be reaching out to you after the presentation and following up with an email. So look for an email from her. And then our presenter. We have a terrific presenter today, Angela Ellis. Angela supervises the TASC programs that provides and integrates SBIRT screening in the Cook County State's Attorney Deferred Prosecution programs. These include the State's Attorney's Drug Abuse Program, Felony Deferred Prosecution, and Misdemeanor Deferred Prosecution. Utilizing internal and external collaborations, Angela is a tireless advocate for community safety, as well as an active proponent for reversing the tide for incarceration of people with substance abuse conditions. She is currently charged with developing and expanding similar community-based services throughout Cook County, which are designed to save costs, address individuals' health issues, and reduce recidivism. Angela has over 18 years of experience in substance abuse treatment and is a 16-year TASC veteran. She has participated in webinars and other trainings related to SBIRT and deferred prosecution programs. Angela earned her Bachelor of Science degree in Management from National Louis University and is a Certified Assessment Referral Specialist. So please join me in welcoming Angela today to present on SBIRT in the criminal justice settings. I'm very excited to have Angela. I've been wanting to learn more about the work that they've been doing and about the application in this setting. So Angela, I'm going to turn it over to you.
Awesome. Thank you so much for such a warm welcome. First of all, I would like to thank everyone for attending the webinar, and I look forward to speaking. For starters, like you introduced, I'm going to talk about SBIRT and the criminal justice system. Some of the learning objectives that you predominantly should receive after the webinar is the basic understanding of the SBIRT model, and descriptions and application of the tools, and knowledge of the Cook County model. And maybe you can determine after the webinar whether this will be a model that will work for your jurisdiction. As we're all aware of the problem, we're talking about multiple thousands of people sitting in jail with substance use and issues. Let me share a bit of statistics I have for you as it pertains to a statistical study done by the Illinois Criminal Justice Information Authority. They reported for the state of Illinois annual bookings totaling 366,962, whereas they were looking at a percentage of 97,241 on felony probation. These are many individuals who are currently involved in the criminal justice system with the big question, were there ever any assessments done? Were there any questionnaires that were created and established to maybe identify reasons why individuals may continue to find themselves in the revolving door as it pertains to the criminal justice system. Also, we look at the criminal justice system, of course, as being the single largest referring source to substance abuse treatment. Could that be true or could it be false? According to statistics, it's true. We're looking also a study by the Illinois Criminal Justice Information Authority looking at a percentage of 40% of most treatment referrals come from the criminal justice system. SBIRT, concept and design. SBIRT uses a public health approach to universal screening for substance use problems. SBIRT also provides immediate rule-out of non-problem users, identification of levels of risk, identification of patients who would benefit from brief advice, identification of patients who would benefit from higher level of care, and progressive levels of clinical interventions based on need and motivation of change. When we look at the SBIRT concept, of course, its design is to try to engage the individual to acknowledging, not to accuse, not to be accusive, but to engage them and making them aware of the possibility that there may be some other contributions that are going on in their lives that can be a correlation between criminal activity and other issues that they may have not yet identified. This tool allows us to engage them in conversation and make them aware of the possibility of existing issues that they may not find as a correlation between their current involvement in the criminal justice system. This is the primary goal. The primary goal of SBIRT is not to identify those who have a substance use disorder and need for higher levels of care, but the primary goal of SBIRT is to identify those who are at moderate or high risk for psychosocial or healthcare problems related to their substance use of choices. Once again, I have to state and elaborate the importance of understanding the implementation of SBIRT as we talk about SBIRT. It's a tool that we utilize to try to assist the individual in identifying that there may be current issues that they may want to look at that can be contributing not only to their health care, but also like the psychosocial and many other issues. Just an opportunity to utilize it as an eye-opener for the individual. The acronyms, of course, it's screening, brief intervention, and referral to treatment. The SBIRT tool is a comprehensive, integrated public health approach to the delivery of early intervention and treatment services with substance use disorders. Key word is early intervention. That's exactly why we implement the tool currently in the population we're serving. Deferred prosecution programs are for individuals that do not have extensive backgrounds. Prior to the tool not being implemented, they were not asked of these questions, which is why you would see individuals, unfortunately, continue to revolve in the criminal justice system. You're seeing them getting locked up one week, and the possibility of them getting locked up in a couple more weeks were greater. Whereas once we start implementing the tool, we're looking at the possibility of maybe referring them to speak with someone where they can identify if there's additional services that this individual can benefit from. We try to intervene at the early phases so that we can implement a change with the hope that this individual will become more productive citizens, make more conscious decisions, acknowledge that there may be current issues, and made aware that there are services available for them. Like I just stated, it's set in primary care centers, it's in emergency rooms, trauma centers, currently now in the criminal justice settings to provide opportunities for early intervention with the risk substance users before more severe consequences occur. And because we implement this predominantly in the actual court setting, we have some time constraints, which means we have to work kind of briefly. We got to work hard in building rapport and providing them with as much information as possible and making them aware that not that we're being judgmental, because that's imperative if they're made aware instantly that we're not accusing them, nor are we judging them. Making them aware that maybe there's something they need to look at to avoid severe consequences in the future. Some of the highlights of the Illinois model is it's a federally funded 5-year grant, which we are now going into approximately 3 years. This tool is based in Illinois and currently being utilized in Cook County. We work in collaboration with DASA, Aunt Martha's, Access, Lighthouse, the state's attorney's office, and other substance abuse treatment providers. One of the advantages we have, because I have worked with deferred prosecution programs for many years, we have established such a strong relationship with the state's attorney's office that when the SBIRT tool was first introduced to us, I predominantly already had a set population that I can currently utilize the tool on and who I believe can benefit from this tool. And just a little information as it pertains to the point of interest, just some information I wanted to share. No more than 15 of the expanded SBIRT services are to be provided to adults involved in the criminal justice system within non-correctional community settings located in the same geographic area. I actually spoke with a young fellow approximately a week ago, and he has an interest in learning more about the tool because he predominantly works with individuals that are being released from custody, and with concerns that prior to their incarceration there was involvement with substance use as well as alcohol. So he wanted to know how could he utilize the SBIRT tool. Of course, because we're dealing with predominantly a different population, just so that you're made aware, the tool can be altered to pretty much service and fit the population in which you're serving. He and I talked about it, and I said we'll be a little, we'll keep the scoring the same, everything will pretty much stay the same. However, we may have to change up the questions because it's a great tool, but it can be or need to be altered to fit predominantly whatever population you plan on serving. And then we want to talk about the need for the SBIRT services amongst the criminal justice involved person. Of course, we're well aware that the criminal justice system is a major catchment area for people with high-risk alcohol and drug use behaviors. Let's talk about the Department of Justice. The data demonstrates more than 80% of arrestees have used alcohol or illegal drugs within 3 days of their arrest. And also they add more than 60% of jail and prison inmates have been found to meet the dependence criteria. Once again, I have some statistics as it pertains to the Illinois Criminal Justice Information Authority. They stated that it is at a high percentage that most individuals that are released from the criminal justice system do have some involvement as it pertains to illicit drugs and or alcohol consumption. Why SBIRT 2 in the criminal justice system? Its prevalence of alcohol and other drug problems used in the criminal justice system. The tool itself is an opportunity to not only implement and help the individual see that there may be additional issues as it pertains to their health, to their involvement in the criminal justice system. It's also an opportunity to identify the risk and intervene early. It's relevant to rehabilitate and, of course, to recidivism. If we can seek and link these individuals with the appropriate services, chances are greater that once they're made aware, they seek the outcome that they need, that their recidivism will slow down. That's the key thing that we look for in utilizing the tool. And also being able to screen them for brief interventions. Sometimes, depending on the individual, you can actually, according to their scores, you can immediately go into a brief intervention and make them aware that, you know, this is a possibility that there's a correlation between your criminal activity and maybe because of your alcohol consumption or your drug consumption, whichever it can be. Granting them the opportunity to take a look a little further to see what it is that initially got them involved in the criminal justice system. And also determine their level of motivation for change. let's talk about the Illinois task model. The task model is targeted, the targeted area in the criminal justice system where existing programs for services linkages do not exist. One of our key things is being able, an individual that we conduct the SBIRT tool on at that point, depending on how they score, determines if they need brief intervention, brief treatment, or referral to treatment. And right then and there, a referral's made. They're informed of the referral with the hope that they'll keep their appointments and pursue and find out what it is that they need and seek their services. Like it states, wanted to screen defendants who are not getting screened or assessed. So these are individuals that don't really know that there's a submerged issue. And what we do is we try to kind of make them aware of that so that they know that they're not alone. Like I always state, we're not judgmental, and that there are services available for them, and that, you know, things definitely can be better if they granted themselves the opportunity to take advantage of the services that are available. We collaborated with the State Attorney's Office to set up the model. And of course, like I stated earlier, we pretty much had to tweak it to suit the population that we were serving. And that's like individuals that we would have to change the questions to the last time that you used in the last 30 days versus someone that used maybe a year ago, what was predominantly your drug of choice, that's coming out of the penitentiary after maybe 5 years. They've been in a controlled environment, so you have to alter those questions, and we kind of collaborated with the State Attorney's Office to make sure that the information we were asking was going to be able to be answered by the defendants. We also worked in collaboration with pretrial services as it pertains to the felony deferred prosecution program, because once an individual is referred to the felony deferred prosecution program, there is a brief questionnaire that they ask as well. So they figure sometimes you got to take into consideration the actual criminal justice or the courtroom setting can intimidate some of the individuals. Therefore, they may not be free to talk or open up. So that's when we'll stand, and once they're done with pretrial services, they'll be sent over to us where they're granted another opportunity to speak with someone outside of the courtroom. And that's when we implement the SBIRT tool. Depending on how they score, that information is referred back to pretrial services, and the individuals referred accordingly. We're going to talk about the SBIRT tool. The SBIRT tool is made up predominantly of 3 components. It's the audit, it's the DAS-10, and it's the PHQ, which is the mental health portion. The alcohol use, the audit acronym stands for the Alcohol Use Disorder Identification Test. This part of the audit predominantly focuses on alcohol consumption. Although there's approximately 10 questions, we ask the first 3, and depending on how they score, initiates the need to continue to ask further questions. Then we have the DAS-10, which is part of the SBIRT tool as well, which is the drug abuse screening test, which predominantly talks about the consumption of illicit drugs and the last time that it was used and so forth. We have the PHQ, which is a couple of questions, a few questions as it pertains to mental health. And depending on how they score, that determines whether we'll give them a referral or so forth. We even go as far as asking as it pertains to just tobacco. Do you smoke? How long have you been smoking? Are you willing to quit? And then what we do is we give them information, a 1-800 number where they can call and they can get more depth information on what they can do to quit smoking. Also, something I would like to share with you guys, this is very new, we're currently working on it, and it's also SBIRT but with a questionnaire as it pertains to gambling. We're looking at it currently that there's individuals, gambling becoming a big issue. So we want to start implementing that questionnaire as soon as possible once it's been approved by DASA. And it's going to ask a series of questions as it pertains to gambling. Trying pretty much to implement the same scoring tool that we have for the SBIRT, which will be determine whether an individual will need a referral or so. So I'm excited about that, but that's up and coming. That's something in the near future, but I look forward to implementing that with the tool as well. Because if we can captivate the attention or be able to, in the time frame that we have in court, to give an individual as much information as possible where they can look at all angles of their life as well as aspects and see and maybe identify that there is a concern, we can provide them with information that they can take advantage of. Also, as you can see at the very bottom, that is the Illinois SBIRT website where you can actually physically get a copy of the SBIRT tool, as well as you can read about how it was created, the purpose of why it was originally being created, which was predominantly utilized in the healthcare settings, and the tool itself. So I think it's a great opportunity to go on the site, learn about it, and also look at the material. Let's talk about the settings. SBIRT in Illinois operates in the following criminal justice settings. I have staff that work out of the courthouses in the urban and the suburban settings. We conduct the SBIRT tool out of the felony and the misdemeanor courts. We are available for both calls, which is the AM and the PM calls. And then 5 of the courtrooms, they have rotating judges. However, one of the benefit factors that help us with the felony deferred prosecution program is now that we have a stable judge. So this is a judge that actually will meet with the person when they're first offered the program. And on their court appearances is physically there to see how they're doing, how they're progressing, are they taking advantage of the opportunities that are available for them, and so forth, which I think is it's phenomenal, because once they're made aware that this individual needs a referral here, pretrial services make sure that they're getting their monthly reports and they're communicating with the individual, and the individual does not feel alone. We all play a part in it to the very end, which I think has been very beneficial for the program overall. And like I stated, I have staff that pretty much operates within the courthouses. One of the issues we do have, and continues to be one of our concerns, is always being able to seek private area. You're trying to get these individuals in a court setting that are pressed for time, that want to get out of there. We want to ask them questions, and then unfortunately sometimes we just do not have the privacy we want. So we try to get be proactive and try to get a site as soon as possible. We're going to talk about the population. We're looking at adult offenders with no felony, previous felony convictions. These are predominantly individuals that are referred to the programs that I supervise, which are the deferred prosecution programs. We look at adult offenders with no previous felony convictions, charged with a specific nonviolent offense. Right now, it's the majority. After some of the statistics that were done by the state's attorney's office, has been identified that the majority are male clients. Age ranges from 18 to 70 years old. The means, I would say, is average between 23 to 25. The primary language being used is English. However, we do offer services in Spanish. Most of the referring agencies that we refer most of our clients to are in touch with an interpreting agency, and pretty much there's no language barrier. As I stated earlier, we talk about we operate in 2 diversion programs. The SBIRT tool is predominantly implemented in these 2 majorly, the misdemeanor deferred prosecution program, and which is predominantly out of 1 suburban court and 1 city court, and then we have the felony deferred prosecution, which is predominantly housed at 26 and Cal, which is the main court building here in Chicago. Some of the common charges of individuals that are referred into these programs, as you can see, is retail theft, burglary, possession of a stolen vehicle, and identity theft. I listed these charges because although we're looking at these charges and we're implementing this tool that's geared towards questions as it pertains to alcohol and illicit drugs and so forth, although these are not charges or substance charges or possession of marijuana or none of the above, there's still chances that there's something. We're not going to exclude them from having the tool being questioned, and we still implement the tool regardless if there are charges, any of the that you see displayed, and you'll be surprised what the score is. So we definitely don't discriminate anybody outside of a possession charge. Anyone that's offered the program that's coming through there, we will implement the tool on and grant them the opportunity to speak and see if there is something going on other than what their current charge is, with the hope that they'll seek the services that we will make available for them. The goals of SBIRT in the criminal justice system. We want to provide effective early intervention to defendants. We want to link people to treatment services based on individual needs. We want to educate the criminal justice system on the prevalence of drug use, alcohol, addiction within the courts. I remember when we were first implementing the tool, some of the questions they had within the courtroom were, well, you know, how long is it going to take? Do we have time to do this? Who's conducting it? What's the purpose of it? And we literally had to sit there and tell them, yeah, there could be, although they're coming in for retail theft, there's a possibility that there's something that's contributing to the criminal behavior. So we had to explain to them the possible correlation between the two. And after a lot of advocating, eventually they sought the need for a tool like that and saw it to be identified only as something that they can benefit from. And they welcomed the tool, and we've been implementing it and it's successful since then. Also, it can assist in the Illinois preparation for the healthcare reform. We also do have a county care information that after we talk to them about the SBIRT and so forth, what we do is we'll just tell them if they have insurance. If they don't, then we also introduce them to the county care information. We love to provide them with as much information as possible. Advantages. Let's talk about the advantages. The SBIRT tool, which is very important when you're talking about implementing it in the court setting, you're talking, there's time constraints, very fast-paced atmosphere. So we had to let them know that it's something that can be done really quick, and we had to pretty much stick to time constraints. So the screening is quickly assessed the severity of substance use and identifies the appropriate level of treatment if needed. Brief intervention focuses on increasing insight and awareness regarding substance use and motivation towards behavioral changes. Also refers to treatment providers, those identified as needing more treatment with access to specialty care. Also, like I stated earlier, it grants us the opportunity to continue to advocate for the particular population we serve. It helps us reduce the stigma and the medical model. The judges, like I stated, we had to kind of advocate why we can utilize it, how it wouldn't take up too much time, how simplistic the form was, but how yet it would get information that the defendant can only benefit from. It's brief, easy, it's adaptable. The staff was trained on it, not only by DASA, but there was many times that we had the doctor come in and pretty much sit with the staff, and so that we know we did motivational interviewing to help us with a fast-paced way to have them motivated to fill out the questionnaire. Also, it's an opportunity to educate and raise awareness of substance use in the criminal justice system. Also educates and raises awareness of community treatment networks and educates about the primary health issues and resources. There's a lot of referrals that we've had where individuals had an idea that this was a facility that had to do with treatment, and so forth. And because of the stigma, they felt like they didn't want to go anywhere near it. And we have to make them understand that, you know, we're not judgmental. And it's services, there's so many other services that are available there. And if you can benefit from them, then I suggest that, you know, you just go in one day and speak with someone and then make a decision from there. But the point is trying to get them through the door. Possibilities. We're talking about possible expansion opportunities. Right now, I have approximately 11 court houses that I and my staff work out of. And unfortunately, we don't offer the services in all of the courtrooms. I wish we did, because I think it's only fair for anyone that's involved in the criminal justice system in Cook County should be granted the opportunity to have a screening done on them. So that's something we're pretty much looking at. And also, depending on the success of the program, we're also looking at hopefully expanding and having more revenue allocated for the expansions of this program, for us to implement the SBIRT program in more of the courtrooms. So we're looking into that, and hopefully we will have that resolved soon. Also, increased referrals to build community capacity, working in conjunction with the Affordable Care Act. And once again, my big thing is the stigma buster, makes addiction a public health issue and treat it in a mainstream manner. We always kind of put emphasis on, when we're speaking with our defendants, that you're not alone. There's a lot of people with similar concerns, and the most important thing is that we identify it and take all possible approaches to resolving it and hopefully resulting in a better life for all involved. Most importantly, we like to, when it comes to the SBIRT tool, we're identifying people who need assistance and link them to services. Also, educating clients about the resources that exist in their communities, and continue to work with partners to make a difference. One thing we look at in the aspect as we pertain to the SBIRT tool is we look at it as an opportunity to educate and a form of power that we have to implement a positive change, and also provide this person, this individual, with information that can be conducive for them in the near future if they would take advantage of it. I would like to share a brief story with you guys. We also provide services out of the misdemeanor courtrooms, but it's the mental health, and it's also the veterans. And we conduct the tool, and depending on the scoring of the tool, we make the appropriate referrals. We had a young fellow that actually was a veteran, and he was in the misdemeanor program, offered the misdemeanor program. He took advantage of the opportunity. So what we do is automatically we work with Jesse Brown, veterans, and then there's also a linkage we have with John Marshall Law School. So this individual, I remember personally speaking with him when the program was first being implemented in one of the city courts, and he was so combative. He was like, no, I don't, you know. So I had to sit there and I talked to him and tell him we're not being accusive or judgmental. This is just an opportunity, because sometimes within the criminal justice, or should I say the courtroom, it builds anxiety. People want to get out of there. They really don't want to talk. So because we had this veteran, I wanted him to take advantage of the opportunity. So I spoke with him. We conducted the SBIRT. We told him predominantly where he would be going, and it's just someone for him to speak with and so forth. So he ended up going. He kept his 2 appointments. He had a full evaluation done, and what was later determined that there was some psych concerns. In addition to that, there was some health concerns, and then he was later linked to John Marshall Law School, who would eventually would assist him in seeking services that he wasn't aware were available for him as far as compensation. So once this individual came back to have his case dismissed and so forth, he thanked us, and he says, my God, he says, I didn't know, he was not aware that these services were available. And it's unfortunate that it took a negative experience such as an involvement in the criminal justice system for him to learn this. But the most important thing is that because he was in the misdemeanor felony courtroom, he met with us. the tool, he filled out the tool. He was referred accordingly. He was able to take advantage, and he was introduced to services that he stated himself he never knew existed. He was able to get services. He was able to get health care, and also currently working on, John Marshall Law School is working on as far as revenue that he might be eligible for. And this all pretty much stems from an opportunity that he had and that we had available for him, which was the opportunity to conduct the SBIRT tool on him. And there's many more stories, but in that alone is what's so motivational and wanting to continue to expand and making this tool available throughout our courthouses and anywhere else. It's probably something as soon as you're granted the opportunity, you might want to go on the website and take a look at it, because it's something that can basically be utilized anywhere, and it's conducive for all involved. And I guess that's what really motivates me to want to continue to advocate the need for it to expand amongst all the courthouses in Cook County. And I want to say thank you all for your attention during my presentation. My information will follow if you have any questions, any issues, concerns. My name is Angela Ellis. I'm the supervisor of Cook County for the Deferred Prosecution Program. Or you can contact Alicia Kuziak, Director from TASC in Cook County as well. The pleasure is mine. I enjoy speaking with you guys. And I guess I will hand it back over to Tracy.
Great. Thank you, Angela. That was excellent. Thank you so much. I really appreciate you sharing your experience and your knowledge about what you're doing in Cook County and the implementation of the SBIRT model in your setting. We're going to open it up for questions. A few questions have already come in. I'm going to remind folks that if you'd like to ask a question, we have a question pane over in the control panel on the right-hand side of your screen. And you can just type in your question there. And what I'll do is I will take a look and try to get to as many of them as we can. We have about 10 minutes or so to do that before we wrap up our webinar today. What I've done in the meantime, while you're thinking about your questions and typing those in the chat box, there were some tools, some screening tools that Angela mentioned, the audit, the DAST 10, and the PHQ. And what I did is I went and found links to all of those to make those available to you. One thing I did do is I clicked enter too quickly, and as I was typing DAST 10 in English and DAST 10 in Spanish, and I added the links in there, those are actually to the audit in English and Spanish. And then I followed up with another chat, which actually does have the link to the DAST in English. And then I followed up, you'll see the next in the series is the links to the PHQ in both English and Spanish. So those tools are made readily available to you as you're thinking about implementing the SBIRT model in your setting. And you're selecting tools. These are validated tools that have been used broadly when SBIRT models have been implemented across a range of settings. So these are good, psychometrically sound, validated tools, easy to use, which is also very important. So let's take a few questions here. Let's see. So who can do SBIRT in the criminal justice system? Angela, who does it? So what's the background? Is it a medical professional, behavioral health professional, addiction professional? Can you talk more about who can do it and what background do they need?
Well, predominantly, they kind of, because we're currently working in the criminal justice system and we're geared towards the population of individuals that we conduct actual assessments. We have an array of programs in TASC. So we're kind of the designated agency that conducts the drug and alcohol evaluations for individuals incarcerated that request one. So by us actively being involved, they kind of asked us what was our intake. So I think as long as it's individuals involved in the criminal justice system, rather it's for addiction, for treatment. I think at that point, those are individuals that can implement the tool in that particular setting. However, because it not only talks about substance abuse and alcohol, it also talks about mental health and tobacco, that can pretty much be utilized where individuals might feel that it's conducive. It probably would have to be restructured to fit a particular population, but right now I think it's kind of being utilized. It was originally utilized in the healthcare setting, and right now it's being implemented in the criminal justice system.
So you think that folks with a broad range of backgrounds, so it could be paraprofessionals who may not have formal training in any particular...
Almost definitely. Oh, yeah.
All the way through a range of disciplines and different backgrounds. And but definitely. One of the things that you just pointed out, I think it's important, is that the more experience they have with the criminal justice system and that environment and that context, you know, an array of backgrounds, it works fine, but knowing the criminal justice system and that environment may be particularly important because you're taking a model and putting it in a very specific type of setting that's different, and it's different population than, say, another setting where the SBIRT model is implemented.
Correct.
Okay, great. Well, thank you. And it looks like I may have already answered this by posting the links about using them in other languages. So I've made the particularly Spanish seems to be the language that folks are most interested in other than in English. And the other question is about use of the screening tool with adults only. Are you, if I remember correctly, you're looking at a population age 18 to 70, so this is an adult population, and the tools that you submitted are primarily used with adults. Are you using, are you looking at using the audit with the young adults as well, or using other specific types of tools for the young adults, or you apply the audit for everyone?
Actually, we're currently utilizing it for adults, but it's right now being structured and being altered to also be utilized for the juvenile component. So that was a question that was raised and always a concern. That's something that's, if we're talking prevention and intervention, we want to start as young as possible. So, yeah, that is something that's currently being discussed as far as being implemented in the criminal justice system as it pertains to juvenile justice.
Great. Well, in being in Illinois and having a relationship with the Lighthouse Institute and the terrific work that they're doing, they have a tool that is for adolescents and adults, and I don't know if you're using that in your setting, but it looks like some folks are interested in that. There's the GAIN, G-A-I-N hyphen S, which is the short screener, and the Lighthouse and Chestnut Health Systems developed that. They're in Illinois, and that is a tool that can be used for both adolescents and adults. There is an adolescent tool out there for substance use, alcohol, and drug use called the CRAFT. If folks that are on this call are working with that population. So there are tools. I think that is important to make sure you're selecting the tool that fits the population, it's been validated on that population. So you're familiar, you've heard of the GAIN yourself. Have you been using that?
I heard of the GAIN and the CRAFT. Yes, I did. I heard of both of them, yes.
Okay, terrific. All right, let's see what other questions we have here. Well, we have a question about the data being collected. I don't think it's really about the analytical piece about how you're doing it, but more about, are you collecting, you're collecting the data. It appears that you're analyzing it, you're looking at outcomes. Have you, do you have any papers or reports available that we could, put a link to our website that we could share information about the outcomes? Do you happen to know what outcomes you're seeing so far?
I most definitely can get you that data.
That would be terrific. Yeah, that would be great. Now, do you know what percentage of the people receiving this particular question is looking at outcomes, and it says, so the data that is being collected and looking at the outcomes so far, for example, what percentage of people receiving a brief intervention decrease in repeat offenses? Do you have any of that data available? About
Actually, I can get that data for you because we look at it. Right now, the state's attorney's office, what they do is they used to do a 6-month statistical study. It used to be a year and it went to 6 months. Now, because of us implementing the tool and the expansion of the programs, I believe it's being done quarterly. So I can definitely get you that data as it pertains to individuals that are linked and what is the percentage of them being re-involved or re-engaged in the criminal justice system and the time frames and so forth. So yeah, I definitely can get you that data.
Great, terrific. And what we'll do for folks who are interested in that, we'll add the links onto our website, exactly where we pointed you to previously for the PowerPoint, where there's a description of this webinar, where the recording will be posted. That will be there as well as soon as we get those.
Awesome.
And in fact, we have a screenshot here of our webinars, where all of our webinars are listed, where all the resources will be posted. We could even post the links to the tools that I put in the chat box with this particular webinar. So just go to the webinars page, and you can click on the SBIRT in the criminal justice system, and that'll take you to a page that has all this information and links to those articles. Let's see, let me look at a couple more questions here. And I'll just remind folks, if you want to ask a question, use your question pane. Let's see. So this question is the SBIRT model currently in use in Westchester County, New York? Is it always associated with the TASC model? And this is from a person in New York. Are you aware whether this model is in use in Westchester, New York? Is this specific to the TASC model?
Oh, you know what? I'm not sure, but I can definitely find that information out and be able to submit that to you.
Oh, that would be great. Thank you. That's terrific. We get interest from all over the country. I've had folks contact me recently specifically about this, knowing, are there other counties out there doing it? I think, people point to Cook County as the place where they think to go to first. What can we learn from you and your team? And they're not really aware of what else might be going on in other counties. So anything you could point us to, a link, information about what else is going, that certainly would be, I think, helpful to other people. I think when we pull people together and link people who are doing similar things, they can help with navigating the barriers and challenges to implementation, and it can be kind of a support to know that other people out there wrestling with the same kinds of issues. And let's see here. I think there was a question about using this model and these tools with populations who are already incarcerated. I think that's what the question is trying to get at. Is have you been doing that where with folks who have been incarcerated for a while, not just as part of the process that you were talking about earlier?
Right. Well, I had mentioned earlier in the webinar that there was a young fellow that I spoke with out of California about a week ago. We did a conference call, and he's kind of interested in the SBIRT tool because he deals with individuals who are currently incarcerated who are about to be released. And what he wanted to know is how he can implement that tool on individuals who are about to be released from the penitentiary. And he and I are actually, and I spoke with him about the questionnaire and so forth, and that's where I stated that it would have to be altered to fit that particular population. So, yeah, there are individuals that are also interested in pretty much implementing the tool, not only in the beginning stages as a preventive measure, but also utilizing it as a tool that you can get information and knowing how to refer this person to the appropriate services once he's being released from prison. So that's something that's I'm currently actually discussing that with someone, and we should be meeting pretty soon. So I believe the SBIRT tool will be pretty much implemented in the near future as it pertains to the criminal justice system on all levels.
Well, that's terrific. Well, we want to stay in touch, and as you get further down the road and working on that, we might invite you back to talk about how that is different from what you're currently doing. And I know there are other folks out there that have contacted me and are interested in the same thing, and you could share your experiences then. So we look forward to hearing how that goes. There's another question here, and this always comes up in terms of implementing the screening, and you're administering the screening, and we often hear, well, people aren't going to tell the truth. People lie. They're not going to tell me about their substance use. And that's in settings where there's really not a legal issue involved. I hear that a lot. And so just get your thoughts on that. You talked about establishing rapport and quickly and having to ask these questions. Can you comment on that? Do you find that people may be less likely to report their use?
Well, and we know one of the constraints we have, not only time constraints, it's because of the environment that we're actually conducting the questionnaire in, which is in the courtroom. So one thing that we actually, and maybe people want to look into in being proactive as it pertains to one day implementing the tool, is we actually took up a lot of motivational interviewing. We had Dr. Eisenberg come out to our facility and kind of, taught us how to engage and look at the time constraints that we have, and what are some of the key things we look for in body language, facial expressions, and being able to identify. Because sometimes as a clinician, you may not be able to get that information, but because you're able to identify body language and so forth, you may still want to grant that person the opportunity to be referred somewhere where he's taken or she's taken out of the court setting, and is granted maybe a more relaxed environment where they're able to engage in dialogue and so forth. So one key thing I would say is it's important, and the fastest way that you can, building rapport, and maybe really looking into some motivational interviewing.
Well, thank you. That's very helpful, and something that you see when SBIRT models are implemented in other kinds of settings. You see that can be an integral part of the education, professional development, and training to help facilitate those conversations from start to finish screening through the BI and the referral. We are getting very close to the hour, and we've gotten to many questions. I know we didn't get to all of them. I imagine you put your contact information up, and folks want to contact you directly to get some burning questions answered. I imagine you'd be open to that. So I want to thank everyone for your thoughtful questions and interesting questions. And I just want to take a few more minutes just to remind folks that the PowerPoint slides and the CE quiz can be accessed from, you can see behind the scenes, Misty has already posted a link in the chat box that will take you directly to the CE quiz. But you will be able to link to the CE quiz there's another link she just posted. So in addition to the CE quiz, you'll also link to the evaluation form. I cannot stress enough how important the evaluation form is. We are able to provide you this kind of quality education and the continuing education credit by engaging you in this wonderful professional development opportunity. And so what we'd ask of you is if you could take 1 minute or less and to complete that evaluation. That is the primary measure by which we are evaluated. So it is really, really critical. I cannot stress that enough. So it's just as important as the CE quiz. And I'd also just remind you that the future webinars are also offering free CEs, so please take advantage of those and share this information with your colleagues. There's certain topics you may be working with social workers or nurses or other folks because you have a multidiscipline setting in which you're working. Share these resources, share the webinar series, and here is a list, as you can see, of the different topics that are coming up and that we talked about earlier in the presentation. And then I want to thank everyone for attending. Again, it's not possible to do this without our partners, the National SBIRT ATTC, the Big Initiative, and NORC, and of course NADAC. And so we thank everyone for joining. And thank you, Angela, for this terrific presentation. We look forward to getting more materials and resources from you and putting those up on the website and staying connected to learn about what you're doing. So thank you so much, and thank you, everybody, for joining.